We also want to discuss what it means to be an organ donor and also a living donor. There is a difference. Tonight, we are blessed to have nephrologist with us, Dr. Hassan Ibrahim from Baylor Scott & White, which basically means he's a transplant specialist. Can you tell us a little bit more about your role and what you do on a day-to-day basis?
Yeah, and Tony was certainly one of the lucky people who had a chance to get a deceased organ. Unfortunately, in Texas, there's 10,000 people on the list, and the waiting time is currently anywhere from 5 to 7 years. So a kidney transplant recipient is certainly much better off getting a transplant. In fact, those who get a transplant live 3 times longer, not to mention the quality of life that comes with it. But unfortunately, the wait time is so long, so getting a kidney from a live donor is certainly the most ideal way to do it, because you could time your surgery very quickly. You could get the surgery done before you get complications from the disease. And perhaps the most striking statistics about live kidney donation, which people do not appreciate, is that the odds of never ever having kidney failure in someone who donates a kidney is over 99%.
That's remarkable.
And we've done quite a bit of research where we asked thousands of donors about their donation experience. 99% said they would do it again.
Oh, I love that.
No regret. And I think that's thanks to the way the system is set up, where the donor has to undergo extensive testing to make sure they're healthy enough to donate. And also, we are very committed to following the donors as long as needed to make sure they continue in good health. But without a question, live donation will take care of the people on the list and avoid the burdensome nature of dialysis.
I actually know someone who was a living donor, gave their uncle a kidney. I know someone who was on, my grandmother and my uncle were both on dialysis and were not afforded that luxury. I think that most people know, okay, if I want to be an organ donor, if I've passed on, I check it on my license. How do we become a living donor?
Yeah, certainly most programs have an online platform where people register to, it's basically a health survey, ask them questions about their health, and once they pass the screening criteria, they're contacted almost immediately by our center for certain, and we bring them in as soon as they're able to come in. And I think what's really important for people to know is that people have to share their story about the need for a kidney transplant. In fact, I think of it, if you need $50 and you don't tell anyone you need $50, nobody's going to hand it to you. People who share their story are 7 times more likely to find a live donor. How you share it is a matter of personal taste. People put it on a t-shirt, people put it on the back of their truck. And my advice to people who are unfortunate with kidney failure, when they speak to others about their need for a transplant, the first question they get asked, are we a match? Are we the right blood type? The answer should be it doesn't matter, because even if the person interested in donating to you is not a match, there's some other pair who have the same situation where you could actually exchange the kidneys